A child from Bihar comes with fever. Blood examination shows sheathed microfilaria with nuclei up to tail tip. The diagnosis is lova. Nematodes are differentiated from other worms by absent fragmentation, cylindrical body, separate sexes, and in nematodes, GIT is formed completely. Kiran, 30-year-old man, presented with subcutaneous itchy nodules over left iliac crest. On examination, they are firm, non-tender, and mobile skin scrapings which contain microfilaria and adult worms of Onchocerca volvulus. Taenia solium, acanthamoeba, and negleria. These all are neuroparasites. Pigs are reservoir for Taenia solium, Trichinella spiralis. Autoinfection is seen with Enterobius. Fertilized eggs of Ascaris, larva of Strongyloids, Trichuris trichura. These all float in saturated salt solution. Parasites causing lung infestation are Paragonimus westermanni, Echinococcus granulosus, Echinococcus multilocularis. Cercaria are infective form of Schistosoma hematobium. Schistosomiasis is an example of metazoonosis. Tail tip free from nuclei is for Wuchereria bancrofti. Malabsorption syndrome is caused by giardiasis, strongyloids, Scapillaria philippinensis. Virus can be isolated from clinical samples by cultivation in tissue culture, embryonated eggs, and in animals. Prokaryotes are characterized by absence of nuclear membrane. Acute primary amoebic meningoencephalitis is diagnosed by trophozoite in CSF. Amoebic colitis is caused by Entamoeba histolytica. Flask-shaped ulcers are present here. Cecum is most commonly affected. Next question. An anxious mother brought her 4-year-old daughter to the pediatrician. The girl was passing loose bulky stools for the past 20 days. This was often associated with pain in abdomen. The pediatrician suggested the stool examination, which showed Giardia lamblia. Next question. A patient present with diarrhea, analysis of stool on wet mount shows mobile protozoa without RBCs and pus cells. The diagnosis is giardiasis. Entamoeba histolytica, Trypanosoma cruzi, Trypanosoma gondii, these all causes encephalitis. Giardiasis leads to malabsorption. Visceral leishmaniasis is diagnosed by blood smear. Standard treatment for visceral leishmaniasis consists of pentavalent antimonial compound, which is the drug of choice in most of the endemic regions of the world. But there is resistance to antimony in Bihar, in India, where amphotericin B deoxycholate or miltefosine is preferred. Mucocutaneous leishmaniasis is caused by Leishmania brasiliensis. In Giardia, trophozoites and cysts are seen in man. Some important points about toxoplasmosis. It may spread by organ transplantation. Maternal infection after 6 months has high risk of transmission. Oocyst in freshly passed cat's feces is not infective. Applic forms or axol forms are seen in Plasmodium falciparum. Toxoplasmosis in the fetus can be best confirmed by IgM antibodies against toxoplasma in the fetus. 35-year-old male suffering from sudden onset of high-grade fever. On malarial slide examination, all stages of parasites are seen with schizons of 20 micron size with 14 to 20 merozoites per cell and yellow-brown pigments. The diagnosis is Plasmodium vivax. Toxoplasmosis is caused due to ingestion of oocysts from cat's feces. Toxoplasmosis in pregnancy, spiramycin is the treatment of choice. Gametocyte is the infective stage for mosquito in case of Plasmodium vivax. Microsporidia is a protozoa. It is associated with diarrhea in HIV patients. Causative agent of malaria is protozoa. Protozoa associated with megaesophagus is trypanosome. Toxoplasma in children causes chorioretinitis. In giardiasis, only cyst is infective. A traveler presented with conjugated hyperbilirubinemia and, on investigation, egg was found in his biliary tract. Likely organism is Clonorchis sinensis. Ingestion of raw fish leads to gallbladder cancer due to Clonorchis sinensis. Commonest parasite of CNS in India is cysticercosis. Brain parenchyma is the most common location of intracranial neurocysticercosis. Babesiosis is most commonly seen in patients without a spleen. The best method to detect strongyloids larvae is by Behrman technique. A teenager who works in a dog kennel after school has had a skin rash, eosinophilia, and an enlarged liver and spleen for 2 years. Visceral larva migrans is the likely cause of this infection. Onchocerciasis is transmitted by the bite of fly. In toxocariasis, the infestation is acquired from both dogs and cats. A 30-year-old patient presented with features of acute meningoencephalitis in the casualty. His CSF on wet mount microscopy revealed motile unicellular microorganisms. The most likely organism here is Naegleria fowleri. Winter bottom sign in sleeping sickness refers to posterior cervical lymphadenopathy. In adults, toxoplasmosis is usually asymptomatic. Toxoplasmosis is an anthropootic disease. Encephalitis is uncommon in immunocompetent individuals. The incidence of transplacental infection with toxoplasmosis is highest in third trimester, but the infant is not severely affected. The pathogenicity of Entamoeba histolytica is indicated by nuclear pattern, ELISA test, hematophagous trophocyte, zymodyne pattern. Giardiasis is associated with autosomal recessive agammaglobulinemia, and also it is associated with common variable immunodeficiency. Renal transplant patient was admitted for graft rejection and pneumonia. A routine evaluation of his stool showed rhabditiform larva. Subsequent follow-up revealed similar worms in his sputum. The most likely organism is strongyloids. Infection with Bancroftine filariasis requires a mosquito for transmission. Entamoeba histolytica infection is best diagnosed by sigmoidoscopy and aspiration of mucosal lesions and by ELISA. A protozoan with a characteristic jerky motility is commonly observed in vaginal secretions. Crabs act as secondary intermediate host for Paragonimus westermanni. CSF specimen is used to diagnose infection with Naegleria fowleri. A previously healthy 24-year-old man is brought to an emergency room because of seizures. A CAT scan reveals a solitary calcified lesion 2 cm in diameter in the right cerebral hemisphere. The most probable diagnosis is cerebral cysticercosis. Beef, if ingested raw or poorly cooked, can be the source of Taenia saginata infection. A woman presents in third trimester with high fever. Her peripheral smear is positive for Plasmodium vivax. Here, the baby may be low birth weight baby. Zymodyne analysis, nested PCR, and hematophagous trophozoite. These all can differentiate pathogenic from non-pathogenic entamoeba. Next question. Except in infections with very high parasitemia, only ring forms of the early trophozoites and the gametocytes are seen in the peripheral blood. This is an important diagnostic characteristic of Plasmodium falciparum. The most virulent Plasmodium species causing malaria is Plasmodium falciparum. Unfertilized eggs of Ascaris does not float in saturated solution of saline. Fertilized eggs of Ascaris, trichuris eggs and Ankylostoma eggs float in saturated solution of saline. Tuberculosis, cysticercosis and bacteroids, these all causes brain lesions. HIV patient with malabsorption, fever, chronic diarrhea with acid-fast positive organism. Causative agent is Isospora. Congenital toxoplasmosis is diagnosed by detection of IgM in cord blood. Here IgA is more sensitive than IgM for detection, and also dye test is gold standard for IgG. Post-Kala-Azar dermal leishmaniasis is caused by Leishmania donovani. Nematodes which give birth to larvae are Trichinella spiralis, Dragungulus medinensis, Wuchereria bancrofti. Amoebiasis is not transmitted through vertical transmission. Amoebiasis is transmitted through fecal-oral route, oral as well as vectors like cockroach and flies. Trypanosomiasis is not a mosquito-borne disease. Yellow fever, dengue and filariasis, these all are mosquito-borne diseases. Sabin and Feldman dye test is used to diagnose infection with toxoplasmosis. Seed worm is entropius. Babesiosis is transmitted by heart ticks. Cranial calcification is caused by toxoplasmosis. An AIDS patient presents to his primary care physician with a 2-week history of watery known bloody diarrhea. In this case, Cryptosporidium, Cyclospora and Isospora are acid-fast parasites that can cause opportunistic infections in HIV-infected patients. A 30-year-old female stored her contact lenses in tap water. She noticed deterioration in vision and visited an ophthalmologist who diagnosed her with keratitis. Culture would likely reveal acanthamoeba. A divorced working mother takes her 4-year-old child to daycare center. She has noticed that the child's frequent stools are non-bloody, foul-smelling and fatty. The child has no fever. Here we should suspect infection with giardiasis. Human infection with beef tapeworm is usually less serious than infection with pork tapeworm because larval invasion does not occur in beef tapeworm infection. Trypanosoma cruzi initially penetrates through the mucous membranes and then multiplies in a lesion known as chagoma. In the chronic stage of the disease, the main lesions are observed in digestive tract and in the heart. One of the most clinically significant infection in patient with AIDS is Pneumocystis jirovecii pneumonia. The method of choice for detection of Pneumocystis jirovecii in respiratory specimen is by direct fluorescent antibody microscopy. Trichomonas vaginalis is the protozoa which exists in the trophozoite stage only. A medical technologist visited Goa and consumed raw fish daily for 2 weeks. 6 months after her return to her home, she had a routine physical examination and was found to be anemic. Her vitamin B12 levels were below normal. The most likely cause of her condition is infection with fish tapeworm.